Anna Duggar's emergency C-section required after baby shows distress. Reports have emerged confirming that Anna Duggar underwent an emergency cesarean section following complications observed during labor. According to multiple sources, the procedure was performed after medical personnel identified signs of distress in the newborn, necessitating immediate surgical intervention to ensure the safety and health of both mother and child. Observers note that emergency C-sections are often implemented when complications arise during delivery that could jeopardize the well-being of either the infant or the mother, reflecting the urgency and medical necessity of the situation. According to hospital insiders, Anna was closely monitored throughout labor, with medical teams prepared to respond to any indicators of fetal distress. Reports suggest that during the later stages of delivery, healthcare professionals observed changes in the baby's heart rate and oxygen levels, prompting the decision to proceed with an emergency C-section. Sources indicate that the swift response was critical in mitigating potential risks and ensuring both immediate and long-term health outcomes. The hospital reportedly implemented standard protocols for high-risk deliveries, including continuous fetal monitoring and rapid mobilization of surgical staff. Multiple observers indicate that the medical team acted decisively to maintain safety for both mother and child. While the specific medical details remain confidential, sources note that Anna remained under close observation before, during, and after the procedure, with postpartum care administered according to established guidelines for recovery and monitoring. Family sources suggest that the Duggar family was notified promptly of the emergency situation and responded with concern and support. Observers indicate that immediate communication with close relatives and hospital staff was essential in managing the emotional and logistical aspects of the delivery. Analysts highlight that family support is often a critical factor in maternal recovery and postnatal adjustment, particularly in high-pressure or emergency situations. Reports indicate that Anna's condition following the C-section was stable, with medical staff confirming that she received comprehensive post-surgical care. Sources note that recovery from an emergency cesarean typically involves monitoring for infection, management of pain, and ensuring proper healing of the surgical site. Observers emphasize that such care is essential in preventing complications and supporting the mother's overall well-being during the critical postpartum period. The newborn reportedly received immediate evaluation and care from neonatal specialists to assess overall health, response to the delivery, and any potential complications arising from the observed distress. Reports suggest that the medical team implemented protocols to stabilize the infant, monitor vital signs, and provide any necessary interventions to support breathing, circulation, and general health. Observers indicate that rapid neonatal assessment is standard practice following indications of fetal distress and emergency cesarean procedures. Sources indicate that the Duggar family maintained a discreet presence at the hospital, ensuring privacy and support while allowing medical staff to conduct procedures without interference. Analysts note that maintaining discretion during emergency medical interventions is critical for protecting patient confidentiality, reducing stress on both mother and family, and allowing healthcare professionals to operate effectively. Observers report that public reactions have varied, with social media commentary expressing concern for Anna's health and the well-being of the newborn. Experts emphasize that while public interest in high-profile families is common, it is essential to prioritize privacy, medical accuracy, and sensitivity when discussing emergency medical procedures. Analysts note that accurate reporting should focus on verified facts, procedural details, and patient safety considerations without speculation or dramatization. The medical decision to perform an emergency C-section reportedly involved careful assessment of risks and benefits, with healthcare professionals determining that surgical delivery was the safest option given the newborn's distress. Sources indicate that the decision-making process involved continuous monitoring, consultation among obstetricians, and adherence to established clinical protocols designed to protect both mother and child. Reports further suggest that the surgical procedure proceeded without complications, with post-operative monitoring ensuring stabilization of vital signs and assessment of both maternal and neonatal recovery. Observers note that effective post-surgical care includes monitoring for bleeding, infection prevention, pain management, and ongoing evaluation of neonatal health indicators. Family sources indicate that support mechanisms were implemented immediately following the procedure, including visitation protocols, counseling resources, and coordination with medical staff to address any concerns. Analysts emphasize that structured support is essential for maternal recovery, infant care, and the management of potential emotional stress resulting from emergency delivery scenarios. Observers report that Anna Duggar is expected to undergo routine postpartum follow-up appointments to monitor healing, assess recovery progress, and address any potential complications arising from the C-section. Experts indicate that follow-up care is a standard component of surgical delivery, ensuring that both mother and child achieve optimal health outcomes following emergency intervention. The newborn reportedly responded well to initial care, with medical staff confirming stabilization of vital signs and monitoring for any ongoing effects related to the distress observed during labor. Sources indicate that neonatal care included regular assessment of feeding, breathing, and general responsiveness, consistent with established postnatal protocols for infants delivered under emergent circumstances. Reports suggest that the emergency C-section was completed with adherence to best practice surgical procedures, including sterilization protocols, anesthesia monitoring, and careful management of intraoperative conditions. Observers highlight that such measures are critical in minimizing complications and promoting rapid recovery for the mother. Family members reportedly expressed relief and support following confirmation of Anna's stable condition and the newborn's health. Sources note that immediate emotional and logistical support is integral to facilitating post-surgical recovery and promoting family cohesion during medically stressful events. Analysts emphasize the role of family presence in enhancing psychological well-being and facilitating adjustment to postnatal care requirements. Observers report that hospital staff maintained strict adherence to confidentiality protocols while managing public curiosity and media attention. Sources indicate that safeguarding patient privacy, particularly in high-profile cases, is essential for ethical medical practice and protecting both the mother's and infant's rights during vulnerable periods. Reports indicate that Anna Duggar is anticipated to continue receiving comprehensive post-operative care, including pain management, wound assessment, mobility support, and guidance on postnatal recovery practices. Experts note that systematic follow-up is critical for preventing complications, monitoring healing, and supporting maternal well-being. The newborn reportedly remains under ongoing evaluation to ensure proper adaptation to extraterrene life, monitoring for any delayed complications or responses to perinatal stress. Observers emphasize that neonates delivered under conditions of distress require careful assessment, specialized care, and structured follow-up to promote long-term health and developmental outcomes. Sources indicate that Anna Duggar's emergency C-section has highlighted the importance of responsive medical intervention in high-risk or emergent labor situations. Analysts note that prompt surgical action can prevent adverse outcomes, stabilize neonatal health, and ensure maternal safety, underscoring the critical role of continuous monitoring and rapid decision-making in obstetric care. Family and medical sources confirm that the Duggar family is focused on supporting Anna's recovery, managing the newborn's needs, and ensuring privacy during the early postnatal period. Observers report that structured care, emotional support, and adherence to medical guidance are essential components of the family's response to the emergency delivery. The leak of information regarding the emergency procedure has prompted discussions regarding the challenges and risks associated with childbirth. Experts emphasize that while public attention may be high, accurate reporting should focus on medical facts, patient safety, and the procedural context rather than speculation or dramatization. Analysts note that emergency C-sections are a critical intervention when signs of fetal distress are present and can significantly improve outcomes for both mother and child. Hospital sources indicate that protocols for maternal and neonatal monitoring remain in place, including vital sign assessment, wound care, mobility support, feeding evaluation, and psychological support where needed. Observers emphasize that comprehensive post-operative care is essential in minimizing risk, promoting recovery, and ensuring long-term health outcomes for both mother and infant. Family sources report that immediate communication and support networks were activated following the emergency delivery, with close relatives coordinating with medical staff to facilitate care and reduce stress. Analysts note that such coordination is critical in high-profile cases to balance privacy, emotional support, and effective medical oversight. Reports suggest that Anna Duggar's medical team will continue to monitor her recovery over the coming weeks, addressing potential complications, evaluating healing progress, and providing guidance on postnatal care practices. Observers highlight that systematic follow-up is a standard and necessary component of post-surgical maternal care. The newborn reportedly continues to receive specialized care, including regular assessment of vital signs, feeding patterns, and adaptive responses to extraterrene life. Experts note that ongoing evaluation and monitoring are essential in ensuring the infant's health and identifying any early indicators of complications related to the initial distress. Family sources indicate that emotional support for Anna and coordination for the newborn's care remain central priorities. Observers emphasize that structured family engagement, professional guidance, and medical oversight are critical for promoting health, well-being, and stability following emergency childbirth. Hospital insiders confirm that the emergency C-section was executed according to established obstetric protocols, including sterile surgical procedures, anesthesia monitoring, and intraoperative assessment to ensure optimal outcomes. Analysts highlight that adherence to procedural standards is fundamental to preventing complications and supporting maternal and neonatal health. The Duggar family reportedly continues to manage both privacy and public interest, balancing the need for discretion with necessary communication to close friends, relatives, and supporters. Observers note that high-profile families often face increased attention during medical events, reinforcing the importance of confidentiality, controlled access, and structured support. Sources confirm that Anna Duggar's condition post-surgery remains stable, with medical staff monitoring her recovery, providing guidance on post-operative care, and ensuring the newborn's health is closely observed. Analysts note that such measures are standard practice following emergency cesarean procedures and are essential for long-term outcomes. Reports indicate that the Duggar family is focused on supporting Anna's emotional and physical recovery, ensuring the newborn's well-being, and maintaining privacy during this sensitive period. Observers emphasize that structured support, professional oversight, and careful management of postnatal care are crucial for both mother and child. The emergency C-section reportedly exemplifies the necessity of rapid medical response during indications of fetal distress. Hospital sources confirm that swift action, continuous monitoring, and coordinated care contributed to the positive outcomes observed for both Anna Duggar and the newborn. Family insiders indicate that emotional support, privacy, and medical oversight remain central priorities following the procedure. Analysts note that structured follow-up, coordination with healthcare professionals, and attentive care are essential to fostering recovery and stability in the immediate postnatal period. The reports confirm that Anna Duggar's recovery will continue under close supervision, with monitoring of surgical healing, maternal health, and the newborn's adaptation to life outside the womb. Observers emphasize that structured post-operative care, ongoing assessment, and family support are critical components of successful recovery following emergency cesarean delivery. Hospital and family sources indicate that both Anna Duggar and the newborn are in stable condition, receiving attentive care and structured support. Experts highlight that emergency C-sections, when performed promptly and with adherence to medical protocols, significantly reduce risks and improve outcomes for mother and child. The Duggar family reportedly continues to coordinate medical care, emotional support, and privacy management to ensure optimal recovery and stabilization for both Anna and her newborn. Observers emphasize that structured oversight, professional guidance, and attentive family involvement are essential in navigating post-surgical recovery and newborn care successfully. Thanks for watching.